Good morning. It's good to be with you again back at Howard. I was telling Barbara the last time I was here was to perform in a drag show for Blagosa. As Barbara mentioned, Stigma has presented in our SPINS, Special Projects of National Significance initiatives, as persistent barriers to participant recruitment and access to HIV primary treatment, consistent with other findings. It's also been associated with delayed entry into care in most of initiatives, and it's also been reinforced by social cultural factors, i.e. race, sexual orientation, and gender norms. For example, in our Caribbean initiative conducted from 2003 to 2007, HIV, stigma, and homophobia thwarted the efforts of some of our demonstration projects in Brooklyn, the Bronx, and in Queens to work effectively with churches. However, sometimes we find something unexpected about stigma, and here's an example from one of our prior initiatives, the SPINS U.S.-Mexico border initiative conducted from 2001 to 2005. Sexual orientation stigma was found not to be significantly associated with delayed care entry for this sample. The findings suggest the concerns over being thought of badly or HIV stigma sped up the process of entering care. This reverse effect was possibly due to fears of those being negatively viewed by friends, family, and coworkers, which actually push people into care to delay the effects of the progression of the disease and therefore stave off any visible signs of illness. This is very much following the Goffman model. These folks are actually looking to remain in the discreditable category. Therefore, they're focused on what's called identity management of their particular stigma through concealing it, i.e. passing. Here are our current SPINS initiatives. As you can see, most of these specifically focus on marginalized populations heavily impacted by HIV and other stigmas. The SPINS Women of Color initiative, now in its fifth and final year, involves 10 demonstration projects, 5 urban and 5 rural. We have accrued a sample of 936 women of color receiving primary HIV/AIDS medical services with an 18-month follow-up for 2/3 of the cohort. Variety of access to care interventions involved by these demonstration projects. I wanted to share one of the particular stigma reduction efforts in that initiative. This is an adaptation of the Healthy Relationships DEBI, or Diffusion of Effective Behavioral Interventions, conducted at the Ruth M. Rothstein Core Center in Chicago and also at the University of Texas Health Sciences Center at San Antonio. It's focused mostly on empowering women to disclose their status to their male partners, their families, their friends. So we had about 50 women in 6 cohorts, and 33 of them graduated. I have permission to share a couple of vignettes from that particular intervention. One involved a mom who wanted to disclose her status to her daughter and was quite fearful of doing that. And after she'd graduated from the Healthy Relationships workshop sessions, she picked a day and she came up to her daughter and told her, and her daughter said, "Mom," took her arms and said, "Mom, I already knew." Another woman was working on trying to disclose to her best friend, and eventually she picked the day and the moment and told her best friend, who then disclosed to her that she was also HIV positive. In our SPINS Homeless Initiative, now in its second year, there's a stigma sub-study to examine how HIV stigma negatively impacts clinical outcomes and housing status for HIV-positive homeless people. And little is known about how multiple types of stigma interact and impact HIV care. So we also are dealing with the stigma being homeless, as well as sometimes mental illness and sometimes substance abuse, and HIV all at once, 4 intersecting stigmas, if you will. And here's their research question. They're going to follow the Lincoln-Phelan model of enacted versus felt stigma. So we're looking very much forward to these results. This is our brand new SPINS Latino initiative, and we're very excited about this because this is taking a brand new approach really for healthcare in this country and not just HIV/AIDS primary care. The transnational approach, we've asked our demonstration projects to write interventions specific to place or country of origin. We tend to lump all Hispanic Latino people together in this country just because so many of them speak Spanish, and of course that erases their cultural and ancestral histories from their countries of origin. So this particular initiative is going to do that. And unique to this particular initiative are stigma reduction plans. This is the first time we've actually asked our applicants to include specific ways of reducing stigma in their particular interventions. And these are some of the methods that they're including: social media, text messaging, Twitter, Facebook, social networking, project websites, client-centered events and gatherings, health and wellness framed materials, gay-friendly, sex-positive clinical settings, and the inclusion of stigma in provider cultural competency training. And just to look at specifically at some of those stigma reduction projects, Viviendo Valiente project of AIDS Arm in Dallas, Texas, based on the Lincoln-Phelan model again, and working to incorporate the 10 recommendations of AIDS action, which are all very, very, very good. Proyecto Vida of Bienestar Los Angeles, peer-based social networking, network testing, peer-based social network engagement, use of MI techniques, and the inclusion of stigma and cultural sensitivity curriculum for providers. Proyecto Promover of Hectorlin Institute in Chicago. This is actually the core center which was involved in the previous SPINS Women of Color initiative. Again, using that Healthy Relationships Debbie to work on empowering people to disclose, and social marketing, and helping the motivational interviewing again. Clínica Bienestar project of Philadelphia Fight. This is interesting because it's working with Puerto Rican people who, many of whom have past histories of injection drug use and incarceration. It's going to be bilingual, and so it's going to be a very interesting effort. Enlaces por la Salud project of UNC Chapel Hill, a stigma reduction plan here includes sexual orientation and gender identity, so they're focusing on two other stigmas that often lie right behind HIV stigma in the way we model these things. So I know we're a little bit behind, so I will end there. Thank you all.